Hello, everyone. It is my pleasure, privilege, and honor to host our guest today, who is very well known to the World Federation Neurology community. She had been a regular speaker at our forums. She had been behind our atlas on multiple iterations. This is Dr. Tarun Dua, the WHO, if you like, the window for neurology and brain health community for the whole world. Tarun, thank you so much for accommodating time to be with us today on behalf of World Brainday team, public awareness and advocacy team, and World Federation Neurology social media team. It is my honor to warmly welcome you. How are you today?
Thank you, Tessa, for these welcoming words. My pleasure to be here and speaking with you, unfortunately in a virtual manner.
Indeed. Tarun, we have spoken about this topic before, the brain health, but we'll come to that in a moment. Before that, today, I'm going to run this interview slightly differently. I want WFN viewers, so our fan base, to get to know you. So tell us your formative days. You could go as early as you wanted to, primary school days, high school days. Tell us how you were made to this world, and then what inspired you to get into medicine, and then later on pediatric neurology, and then how did you get involved with the World Health Organization and your current status? So plethora of questions. So this is sort of your journey.
Thank you, Tessa. It's been a long time. So I did my medicine from India, from a college in the state of Uttar Pradesh, known as the Jawaharlal Nehru Medical College in Aligarh. Both my initial medicine degree as well as post-graduation in pediatrics. After that, I trained in pediatric neurology in Delhi in All India Institute of Medical Sciences. I was working in Delhi in one of the tertiary care hospitals, and as luck would have it, it was a trailing spouse that I came to Geneva. My husband, he started working with the World Health Organization, and I was, it seems, was at the right place at the right time. The mental health department, in which neurology was then led by Dr. Leonid Prilipko, many of you who might remember. He was looking for somebody to work and finish the job on the first neurology atlas. So I said, okay, I'm available. I started my life as a volunteer with the World Health Organization. Did I think, a good job, because the atlas was well received by the international community. And then it helped me carve a career path within the Department of Mental Health and Substance Use, and to build the pathway on neurology. So worked earlier, and so I have been working on many things, but very important and very fortunate that as within our new leadership under Dr. Tedros, we had the transformation process in WHO. So that meant that different departments, the organization, that we were able to look into creating new units. And so last year was the birth of the brain health unit within the Department of Mental Health, which is extremely important, as you know, this is long recognized that neurological disorders are important causes of disability and death. And so it has given me the opportunity as the head of that unit to see how we can help in promoting the brain health, preventing neurological disorders, and supporting care and management of neurological disorders across the life course, especially in low and middle income countries where resources are scarce. So I'm very excited to be working in the World Health Organization at this time.
Tarun, that's a perfect segue to the next question that I am about to ask, but I'll spend some time here. you and me both know that the World Health Organization defined health as complete physical, social, and psychological well-being, not the mere absence of disease or infirmity in 1948, if I remember correctly. That automatically tells us how critically and pristine important brain health is. You absolutely can't think of complete or not even partial psychological and social well-being without having the some brain or functioning brain health. You and me have this conversation the thanks to our brains being functioning normal, and it is somewhat timely that the one of our former president Vladimir Hachinsky came up with this suggestion to redefine brain health on a short the correspondence that he published in Lancet Neurology only a few weeks ago, basically drawing the same point that you and me are raising today. So we are incredibly excited to see the birth of brain health unit with the World Health Organization. And we were also incredibly delighted to see the 73rd World Health Assembly and resolution of all those 13 paragraphs, which I covered on a different interview for the YouTube channel the late last year. The importance of this was well recognized by World Federation Neurology some times back, but it was somewhat ironical, myself and few others, as a passing remark. If I remember correctly, 2010, we were talking to our president at that time. I was almost sort of a unknown neurologist at that time. I think I had something like one publication under my belt. I was into my second year as a consultant, but I was talkative, of course, and I was a journalist in my previous life. So I was talking to the president and few others from Pakistan and India, and so we were having this casual chat, and we were talking about the importance of having a specific day to talk about brain health, given that we, by that time, as you know, we knew that neurological disorders are indeed the leading cause of disability and second leading cause of death. This was around sort of same time that we were talking about similar things. And to my surprise, the Council of Delegates, or rest of the other 122 member societies, endorsed this idea. And the few of us were entrusted upon to run the first World Brain Day within sort of a few months' notice in 2014. So we ran the first World Brain Day campaign, basically talking about brain health and importance of brain health, raising general awareness. And since 2014, it has really climbed beyond my belief. I'm reasonably confident this year we would reach out to well over 100 million people with the sort of virtual presence, social media existence. Even this interview that we are creating would be part of the contents for that, anyone anywhere in the world can use to advocate for brain health. So how excited are you as the sort of a lead figure in World Health Organization promoting brain health, working in collaboration with all national and international bodies, to see an organization such as World Federation Neurology taking this mantle and then partnering with an individual, another global organization year after year, selecting a disease or craft group of disorders, and then advocating for promoting brain health as the overall overarching agenda.
Thank you, Tessa. I think as we know, and as we are talking about the importance of brain health and the impact neurological disorders have on the life of people who have those disorders as well as their families, much more needs to be done. And this needs to be done at the level of policies. We need to have good governance, leadership around these areas. We need to have good services available. We know many of these disorders have such huge treatment gap. But then also, there is an importance of advocacy and importance of awareness raising of general public around these disorders is extremely important. Many of the neurological disorders are associated with stigma, where people will not come forward with these disorders or go to the health facilities. So I think what I'm trying to say is that we require advocacy at and World Brain Day is an excellent mechanism for that advocacy and awareness raising. So reaching out to the policymakers, reaching out to the young health professionals to emphasize the importance of doing neurology, providing neurological care, to the primary healthcare doctors and nurses, that how they should be able to provide care, and to people that what can be done about it, and how services should be provided. So and this you briefly mentioned, but let me talk a little bit about the new global action plan on epilepsy and other neurological disorders that the WHO Secretariat is currently working on. It's important this year is because we are in the process of developing that action plan. The consultations are ongoing, and next year the World Health Assembly is going to look at that draft and hopefully endorse it. And so that will mean the commitment to reduce the disability, reduce the burden that we have with neurological disorders. And that can only happen if all stakeholders work together and if we are able to advocate. So really very excited, with working together with different partners, including World Federation of Neurology, in these activities.
I think you hit the nail on the head. I totally agree, and I can give you an example from where I currently based at. In Australia, as you know, it's a first world country, and we have close to 500 neurologists, probably around 300, 350 are in practice in some capacity, public or private or academic or all three or part of them. And we also have 31 primary healthcare networks with close to 40,000 family physicians, or family doctors, or GPs. And so I put all sort of neurologist, pediatric, adult, both together when I quote that number. If I were to talk about one neurological disorder, say migraine, which is the leading cause of disability in Australia, the numbers according to global burden disease data, which I'm part of, minding, is close to 5.5 million. So what I'm trying to say is, even if you get headache medicine interested hardcore neurologists to see these patients, they're not going to see them. They simply can't see them. And it is all in synergy. We just have to put our heads together and put our resources together and try and answer these questions as best as we can. And you are absolutely spot on. It is all about getting stakeholders together and using the infrastructure and material that we already have, rather than trying to pass the buck and expect the small number of people to sort out every problem. In an ideal world, that would be ideal, to have a few million neurologists for each country to sort out these problems, but it is not going to happen overnight. And the way that we run World Brain Day campaign is we basically create the variety of contents, basically that include a press brief of the sort of a chosen disease and talking about how common they are. As you correctly mentioned, the treatment gaps and what is needed, this and that, importance of education, so on and so forth. It's usually one pager. And then we basically ask different institutions, different countries, different cities, different hospitals to use that to advocate with their the policymakers, politicians, funders to raise awareness, have sort of press brief and this and that. Then we also create a slide deck on that disease. It's basically a basic slide deck talking about the disease, current prevalence in a sort of very simple way, but we spend a lot of time creating them over sort of preceding months. Then during last 3 years, given that we were becoming more and more virtual, we spent a lot of time creating a whole lot of social media, the plethora of things that can post on Instagram, Twitter, LinkedIn, Facebook, etc. And then we also listen to patients. We invite patients to share their stories in sort of short videos. And we target all craft groups, as you mentioned. I'm particularly running behind medical students globally and the neurology and other physician trainees, other healthcare craft groups, nursing and allied health, and where possible, politicians and policymakers and academics also. And with the sort of same idea, the idea is our brains make us who we are, and the brain health is quite important. Neurology, of course, we are both neurologists. We both know that how exciting the field is. The research avenues are now moving towards the fascinating entities of humanity: mindfulness, love, kindness, compassion, jealousy. We are sort of now the dissecting or sort of unraveling biology behind those aspects. I think they are going to be incredibly fascinating. And we would be very keen to see that these processes continue to occur. And I think the 73rd resolution and all those amendments, I really hope that they would get endorsed, and the humans as a community, we would get the job done as best as we can. Of course, we need to continue to train more healthcare workers and increase resources as much as possible. But the preventative aspect of these disorders should not be ignored, isn't it? Today I was writing a sort of little editorial, and as I was writing, I was basically, they have managed to pin down almost 50% of the dementia can be prevented by targeting risk factors. Almost 80% of the strokes can be prevented by addressing those risk factors. But all these things are awfully underdone. And because they're not quite sexy for some reason, they don't seems to get the attention. And I think the onus are up to us to mobilize forces and bring that much needed synergy, and do everything that is possible to prevent those things where they can be prevented. Of course, you and me both know that the best dementia to have is one that you never had. The best stroke to have is one that you never had. So we hope the visitors of this video would visit World Federation Neurology website and click on the World Brain Day icon and download our toolbox and use them as it belongs to them. We don't hold any copyright, and we are very happy for people to use them as it belongs to them, including translating them into multiple languages. I'm glad to see all those developments and keep us informed, and we could have a different chat later on them. My last question, Tarun, is when you don't work for WHO or the brain health, how do you keep your brain healthy? How do you pass time when you're not working on brain health, but yet preserving your brain health? Share with us how you find work-life balance in Geneva.
Thanks, Desai. I think if we think in terms of our work-life balance, especially in these COVID times, it has, as we have, many of us have been teleworking, it has made us realize the importance of keeping that work-life balance. So we are sitting in front of our screens all the time, and doing many of these virtual meetings. And it is extremely important that we do some of the activities to keep our brain healthy. So physical activity. So I love walking. I am as much as I can. I also play golf. So that those are the physical activity which helps me keep my work-life balance and also keep my brain healthy. I love talking to my family, being in touch with them, with my friends. And so extremely important that we focus on these issues which are good for our work-life balance, good for our brain health.
Absolutely. None of us are going to be here forever, but we are both ardent supporters and promoters of brain health, and we have to preserve it as healthy as possible to maintain the defined health, if you like, the complete physical, social, and psychological well-being, which can only be achieved with preserved brain health as best as we can. My last question is, what is your message to youngsters out there, whether they are in Uttar Pradesh in India or rural Sri Lanka or most rural Australia or Europe or Sub-Saharan Africa or Latin America or North America or Canada or any other country that I didn't mention or any other region?
I would say, I think the most important thing is to each of those young professionals is that, as we were talking earlier, have a good work-life balance, promote and protect your brain health, but also work towards promoting and protecting the brain health of others. As we see that there is no health without brain health. And I think that's what I would like the young professionals to take forward and include them in their working life.
Absolutely. I mean, I totally agree. I think in the middle of this pandemic, with many parts under lockdown, you and me both know how incredibly important every single healthcare worker that is out there, from most junior to most senior. Every person is playing a huge, important role to maintain humanity. And we obviously wanted them to preserve their brain health and extract as best of the humanities as possible from their brain health. And that is the only way that we are going to come out of this calamity, hopefully to a much better world. Tarun, any final take-home messages that we didn't discuss throughout the interview? We are incredibly delighted to see World Health Organization and Brain Health Unit supporting us and endorsing and collaborating brain health or the World Brain Day campaign, which has now become a major activity of WFN. And we are incredibly grateful for that support, and we hope that support would continue to grow, and it is significantly needed. We covered many aspects. Anything else that you wanted to post as final remarks?
No, thanks, Tessa. I think we covered everything. But just to say, I entirely agree with your last comment on the important role health workers have played in this pandemic. So I join you in thanking them on behalf of the World Health Organization.
And also we must conclude this discussion by telling everyone that we are both eternally optimistic that human being is a very smart species, and we will come out of this pandemic to a much better world, and we will know how to collaborate, if not better than in the future. And the pandemic is continuously teaching us how we can do things better, and we are discovering new ways to be in touch with each other's, like this very interview from different parts of the world, while we both probably growing additional synapses as we continue to have reasonably high-level discussions. I am optimistic that we would see a better world, and we would share things better, as WHO is very correctly endorsing and promoting a global response to this global threat. We as brain health promoters, we wanted the world leaders to know that the brain health is at a crossroad, but we need a global response. Just like we are sharing Covishield and vaccines and rest of the other things, hopefully one day two of us can have this conversation discussing about our success of having access to treatment for almost all epilepsy patients worldwide, almost all headache patients worldwide, almost all anxiety patients worldwide, as the the problems are universal and solutions somehow has to be universal also. There's a long way to go, but that's a nice way to end our discussion.
Thank you, Tessa.
All the very best and take care and stay safe.